25 years ago, a long time, Canada, I guess, was celebrating its 125. Now it's 150. So, my goodness, a lot has changed. The greatest change has been society and its relationship with technology. In 1992, I think that's the year, when I decided to go back and really pursue further education. A lot of it was about looking at how to contribute to the healthcare system and knowing that I needed to broaden the experiences and the actual information and knowledge. And so that was really one of the key driving forces why I looked at pursuing further education. In life, I always look at the stars line up. So it's a combination of probably initially being a nurse, in particular a visiting nurse, probably even before that, working in hospitality and knowing how you had to work with people. Then my experience in a large teaching hospital, and then being courageous enough to move into the community, into this sort of wild west of what exists there. And I think it's that whole combination that really has prepared me to be successful in the space and to have organizations that have been successful. Because fundamentally, it's about people and how you care for people and how you accommodate and have your services connect with them, and how to prepare you for the healthcare system and how to be a better contributor there. Well, I didn't start in 1908. It's been a very long time that I've been there. When I look back 25 years ago, why I was interested in moving to St. Elizabeth was I really felt home care was underutilized, a bit undervalued, and absolutely not understood well. And I thought, this is a real opportunity to grow St. Eliz and to have us really spread the impact that we have in people's lives. And we've actually coined that term now to be spreading hope and happiness. And that's really been the vision of St. Eliz, as strange as it sounds, from the day I started till certainly today. And I see that continuing for the future. Well, innovation is it's an interesting concept, and I have always looked at it as the engine for change that's necessary in healthcare. Probably my roots for the passion that I have in innovation actually came from a lot of the UOIT curriculum, which is very interesting because it helped me understand change was necessary. We have looked at a variety of innovation, both process innovation, trying to change the model of care, in particular in the home care environment, social innovation, which is really new solutions to deal with tough problems, and the most exciting is disruptive innovation, where you really turn everything on its head. And you really say, I want to make sure that no matter where people live, what their financial resources are, what their actual condition is, their family situation, they have the kind of death that they want to have, and that be a good death, a peaceful death, a pain-free death. Well, the three areas with First Nations community, end of life, and caregivers is probably where I'm the proudest of what St. Eliz has accomplished, really, as a nonprofit social enterprise. With our end of life care, we have funded $4 million since 2005 to address the gaps and many of the issues that occur in this space, both locally and throughout the country. With caregiver support, that is a very neat disruptive innovation where we now have with Eliz, and that's ELIZZ, there are 2.5 million caregiver connections that we now have with this caregiver support, which is trying to put caregiving into the mainstream of society versus this unique, strange thing that exists when you need to take care of people. We just celebrated our 15th year, We are now in 500 communities providing educational supports so that they can, in fact, take care of their own populations in their communities, and we're simply enabling that to take place. I think both home care and long-term care are important when we look at society and the aging population. And to keep people in their homes for longer periods of time, or for as long as they so desire, is going to require a different way of thinking. And it will require a cultural shift. It was a great honor. It was probably one of the most emotional days. I don't know why. I was full of sort of humility, pride, and reflecting on my own sort of graduation and journey. So that was a thrill. Um, for the future, the challenges will be endless. That I'm certain about in the healthcare space. And now at St. Eliz, we have 9,000, and we call it now Leaders of Impact. So that on its own suggests that we really have a big job to do to really change the lives of people and influence what's happening in our healthcare system.